So now that you've decided to do a total hip replacement, you're a candidate for what's called an anterior approach hip replacement, which means in order to approach the hip, we go through the front of your hip, through the groin to remove the hip and place a new hip. The benefit of this procedure is it's generally a smaller incision. There are no precautions after surgery, which means you may cross your legs, you may bend over, you may put as much weight on it as possible, and the dislocation risks are much, much lower. There are risks, however. Because the incision is in the front right over your groin area, there's a slightly higher risk for a wound complication. There also is a risk for some nerve damage. There is a nerve that runs over the anterior aspect of your thigh called the lateral femoral cutaneous nerve. We isolate that nerve and move it aside during surgery. However, it does get damaged and there will be some numbness only over your thigh for a period of time. About 5 to 10% of patients will have persistent numbness even after a year or two after surgery. When we replace a hip, we are replacing the entire hip. So the hip consists of a socket and a ball. What we do is we remove the ball first. We basically route out the socket and place a metal socket in to replace your damaged socket. We also put a plastic piece in that metal socket that actually serves as your new cartilage, so to speak. And then we replace the ball with a number of different components that we can use, and that new metal ball and plastic insert becomes your new hip replacement.